appropriate phrase. Okay, so all surgery has risks. All surgery has, everything has potential downsides associated with it. Do I need to hold this? Is the audio okay when that's over there? Testing, 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 testing. Is the audio okay like this? Or do I need to hold this? Position 1, position 2. I'm going to try position 2 for a while. So the risks of tummy tuck. So the risks can be associated with the risks of the tummy tuck itself, so specific to the operation and general risks. So the risk of any surgery. Tummy tuck's usually done under a general anaesthetic. They're very safe general anaesthetics, but there are risks associated with anaesthetics. You can both okay. They can. Oh, hold it. Sarah's saying hold it. Tummy tucks can so there's general associated general anaesthetic. You can have a reaction to the drugs they use in the anaesthetic. You can get things like DVTs, clots in your legs that can fly off into your lungs. These are risks with any anaesthetic or any operation. It's a little bit higher with the tummy tuck because you're making the tummy tight, so the venous drainage from the legs, the blood flow back from the legs is less, so you're more likely to get clots in your legs, and clots in your legs can fly off into your lungs, and that's a serious complication. That's a significant problem. So we do a lot of things to reduce that risk, and we try and get you up and walking as soon as possible. That's probably the big one, really. That's a really big worrying risk, really, of a tummy tuck is the clots in the legs. So we put stockings on, we put these things called Flowtron boots on, which blow up your calves. We give you heparin injections to thin your blood, and most importantly, we get you moving as soon as possible. And when you're not moving, I'd say to you, when you're in your bed, keep your legs moving, your ankles moving, keep all that blood circulating. So that's probably the biggest risk, really, of a tummy tuck. But as I say, that is a risk of any operation, although it's slightly higher with a tummy tuck. You can get chest infection, pneumonia, problems with any sort of surgery. Not quite so much with this sort of surgery, because usually it's on fit young patients who are usually pretty motivated, and they get up quite quickly and get up walking, get up and moving quite quickly. So then you've got your specific risks of the tummy tuck. And the first thing I say to people with the tummy tuck, well, with any surgery, is scar. Scar's not a risk, but it's a thing that you have to be. It's a what was the other thing? Risk to complications. It's not really a complication. It's it's going to happen, but you have to be aware of it. And it's a long scar with a tummy tuck, and there's also usually one around the belly button, certainly for a full tummy tuck. So the scar is one thing, is a risk, I suppose. Well, no, it's not a risk, but it's a thing that you have to be aware of. Usually pretty red to start off with, usually fades pretty well, but it can take a year or so for it to properly fade. So that's a thing that you have to be aware of. You can also get dog ears, little bumps at the end of the scar, which usually settle, but if they don't, you can fix them, but you have to leave it a few months because they often do settle on their own. But if they don't settle, you can fix them. Usually be done under a local anaesthetic. So that's a risk. In terms of complications, you can get hematoma, blood collecting inside, means it all balloons up. Have to go back to theatre and have it washed out. That can happen whether or not you use drains, and there's a lot of talk whether you use drains or not with tummy tucks, but whether or not you use drains, you could get a hematoma. So just because you use drains doesn't mean you're not going to get a hematoma. You can get a hematoma either way. Usually happens in the first day or so after the surgery, all balloons up, and you have to go back to theatre and have it washed out. It's not a massive problem. It's not very nice because you have to go back to theatre, but it doesn't affect the long-term result. The other thing is seroma, which is sort of watery. So hematoma is blood collecting, and that happens in the first day or so after surgery. Seroma is watery fluid. It's like wound fluid, which can collect in the space where you've done the tummy tuck. Oh, that's nice. Those lights have gone off. Seroma is a bit of a nuisance, really. It's not a big problem. It's water sloshing about in your tummy, and if that happens, you might have to put a needle in, or we would put a needle in and draw it off with a needle, and sometimes that needs to be repeated. So it's a bit of a nuisance, but it's not a major issue. You can get problems with the wound healing. So obviously the whole point of a tummy tuck is to make it as tight as a drum. You want to make it really tight to give you a really nice contour to your abdomen, but when you're closing wounds tight, there's a risk that they can open up a bit, so you might get little bits of wound healing problems. Quite a lot of dissolvable sutures in there. Sometimes you get little spots and little localized inflammation areas where the dissolvable sutures are. So that's a potential risk. And particularly in smokers, to the extent that if you're a smoker and you can't stop smoking, I would say don't have a tummy tuck, because whenever you smoke, you reduce the blood supply to the skin and you reduce the risk of wound healing. You reduce your chances of adequate wound healing, and so you've got a risk of a problem. Because it's under such tension, when the wound does break down, it can break down really badly. And the only really bad wound breakdowns I've ever seen have been in smokers. So I would advise you, if you can't stop smoking, to not have a tummy tuck. It's that bad. Other risks or complications, unhappy with the result? As I say, if it's too tight, you get wound breakdown. If it's not tight enough, you might say, it's not tight enough. There's a bit of redundant skin there. That's a risk. I mean, we're trying to give everyone the best result we possibly can, but there's always risks that, we either do it too tight or not tight enough. Oh, look at that. Oh, God, I'm using the wrong thing. Oh, what's that? Oh, thanks, Deb. So yeah, so I don't get that from there. So yeah, sometimes the scar settles all right. So sometimes it works out well, but yeah, those are the risks of tummy tucks, I suppose. So not insignificant. Again, it's quite a big op. Got to really think about it, whether it's right for you, but it's pretty informed of the risks versus the benefits. All about the risks and benefits. Which way does it go? If the risks are higher than the benefits, then it's not a goer. But if the benefits are outweighing the risks, then it might be a goer.